Okay, this is my patient, Lisette. Lisette has pain, face this way, at the base of her spine. So she had SI joint dysfunction that we were able to fix. She was always told that the cause of her pain was a scoliosis. And when she came to me, I checked her SI joint. She had an upslip and an outflare, and then her sacrum was rotated. So when I asked her to extend back, she would feel pain right in here. And when I tested her, read my paper on in the Journal of Practical Pain Management on sacral dysfunctions, when I asked her to do a prone press-up test, my left thumb dipped, which told me her sacrum was rotated like this, causing a shearing at the base of her spine. So we strengthened the right piriformis to bring it back into alignment. So when she extends back, she feels pain in here, right?
Yes.
Okay, now I'll have her sit right here. Go ahead and sit right here. And I'm going to have her do like 2-3 sets of 30, something like that. We'll see if we can get it to go to realign. So I have them keep their thigh on the mat, bring the sole of their foot to their opposite calf. And what we're doing here is we're strengthening the right piriformis to bring this back into alignment to stop the shearing. So if you read my paper I just published in the Journal of Practical Pain Management, a sacral shear is always caused by a sacral torsion or an anterior sacral tilt, where it goes like that, which is always caused by usually a hyperlordosis of the lumbar spine. And in her case, she just has a torsion causing the pain right here. We got this to totally go away, but then she went on vacation, stopped doing the exercises, and it started to creep back in, which is common. So people need to do the SI protocol usually at least once a day when they're done, and then this once a day or twice a day. They have to find, what worked for them. But a lot of times, you get to a point usually midway through the rehab, maybe 3 to 4 weeks in, and you can get them to do this exercise, and then it takes their pain away immediately because you're just bringing it back to neutral and it stops shearing the base of the spine. So anytime she has pain, she just does her exercises and it goes away. But that usually doesn't happen in the first couple weeks. It happens in, more in the mid to later part of the rehab process because it's just too far out of alignment to pull it back in. Let me know when you hit 30.
There we go.
There you go. You're struggling there to get that.
Yes.
Okay, stand up for me. Okay, now go ahead and arch back for me. And do you still have that pain in there?
Mm-mm.
Gone. So she just realigned her sacrum like that by strengthening her right piriformis, and now she's back into alignment. So the more you strengthen it, the more it'll just stay on its own. She'll need to do this at least once a day for the rest of her life, but she'll live pain-free.